Good day everyone, this is Heber Ilapiceros, a student nurse from Davao Doctors College, and today I'm going to perform the urinary catheterization. Urinary catheterization is usually performed to the patient who have difficulty in urinating. So a tube will be inserted to the bladder so that the urine will be drained properly or drained freely. So prior of doing the procedure is we need to of course wash our hands before preparing the set. So it's actually to deter the spread of microorganisms. So of course, after that is we need to identify and explain the procedure to our patient. So this is rendering the right care to the right patient, or this to establish rapport or gain rapport. So good day, ma'am. I'm Heber Ilipiceros. I'm your attending nurse, or I'm your student nurse for today, and today we're going to perform a urinary catheterization. So urinary catheterization, ma'am, I'm going to insert a tube in your bladder. This is to drain your urine freely, ma'am. So don't worry, rest assured that upon doing this procedure, we will provide the right care for you po. Do you have any clarification or do you have any concern, ma'am? Nakapabatay ka dugang or nakapabatay asthma? Okay, ma'am. Thank you, ma'am. So, by the way, ma'am, can I check your wristband, ma'am? What's your name again? Ma'am. Jo. So, saan ako gusto tawag mo sa imo ka, ma'am? Okay, ma'am. Jo. Okay. Thank you, ma'am. So after verifying our client's identity, now is we need to provide privacy by screening or closing the room and position patient in a dorsal recumbent with her knees flexed. So this actually promotes patient's comfort and of course privacy. Okay, ma'am, before ako mag-proceed sa procedure po, is it okay if I'm going to close the door and then going to close the window po? This is to ensure our privacy para walang makakita at saka tayo lang dalawang dito po para at least na atay privacy while I am going to perform the urinary catheterization. Okay, thank you, ma'am. So now is I'm going to drape the patient, exposing only the area that we are going to use. So this actually eliminate the patient's embarrassment. So of course, after that is we need to apply direct light visualization of the genital area. This is for proper visualization of the area that we are going to be examined. Okay, so ma'am, I'm going to drape na po para sa ma-expose lang ang ating genital area po as I'm going to do the procedure. Okay po, ma'am? Thank you, ma'am. So, as I've already draped the patient's genital area, now is we need to open the tray and arrange the equipment for convenience and accordingly to avoid contamination of the sterile items. So this actually to increase the speed of performance and of course decrease the spread of contamination. Here. So now, using the sterile forceps is we need to cleanse the area using cotton ball with betadine. So this actually done to minimize the risk of urinary tract infection by removing the surface pathogens. Okay, now is we need to open the set observing sterile technique. This to eliminate the contamination. Here, but we need to put our sterile gloves on. So after putting our sterile gloves, now is we need to put the eye sheet. So this actually to drape the other part aside from the urinary meatus. Here. So after putting the eye sheet, now is we need to lubricate the catheter. We need to lubricate the catheter at least about 1 and 1/2 inches, being careful not to plug the eye of the catheter. So this is actually done to reduce the friction and possible irritation of as the catheter is inserted. So pick up the catheter at least 3 inches from the tip of the thumb. Then we need to place the thumb and one finger of the left or right hand between the labia minora, separate and pull up gently. This is actually to strengthen and urethra and facilitate the insertion. So now is we're going to insert the catheter into the meatus for at least 2 or 3 inches or until the urine begins to flow. This is to relax the sphincter in order to facilitate the insertion of the catheter. So if the specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in the position. So that urine doesn't leak out. And after that is we need to rest the hand in the pubis while holding the catheter in place to prevent the pulling and pushing of the catheter. Because once the catheter is pulled, it is considered to be contaminated. Afterwards is we need to connect the catheter to the urine bag. So the rationale for that is this is to allow the bladder to drain freely by the gravity. So after connecting the catheter to the urine bag is now is we need to inflate the balloon from 10 to 15 cc of sterile water using the 15-20 cc syringe. So this actually to prevent the catheter from slipping out of the position. So here. So we need to secure the indwelling catheter by tapping into the patient's thigh. So I will perform that after the after I inflate the balloon. After I inflate the balloon of the inflating the balloons here. So like this. So that. So like that. So after I inflate the balloon, as I've said this earlier, is we need to secure the indwelling catheter by tapping it to the patient's thigh. So it allows the slack of the tubing to accommodate the patient's movement. So this is actually to eliminate the catheter from being removed. Okay. So ma'am, akong siya i-ano po dito sa, ano po natin, no? Dikit ko siya sa thigh po na. Here. So I've already connected to our patient's thigh. So I will just put it here, the urinary bag here, so that it will allow, of course, comfort, of course, to our patient. Like that. So after that is we need to place our patient in a comfortable position. So of course it will allow or promotes our patients in a patient's comfort. Now is we need to do the aftercare. Of course we need to clean the materials that we've used thoroughly and immediately after doing the procedure. So after draping back our patient, of course we need to perform hand hygiene. Then after perform the hand hygiene or hand washing is we need to record the time of procedure done, the amount, and the color of initial output. This actually to prevent contamination, proper documentation, and enhance proper handover and endorsement. So now patient M is 50 years old female, was performed urinary catheterization. Then the time start at 9 a.m. then it ended at 9:45 a.m. Then her urine is clear.